Dr. Tracy Bailey here with Allergy and ENT Associates in Houston. Acute and chronic sinusitis are both diseases that involve inflammation within the sinus cavities. They differ primarily in terms of severity and duration. Today we're going to talk about those differences and how they might impact your care plan. Acute sinusitis is typically something that lasts less than 4 weeks. It's usually caused by a bacterial or viral infection, but can also be impacted by allergies. This one's usually treated with pain relievers, decongestants, saltwater rinses, and occasionally antibiotics if we think it's a bacterial infection. Symptoms of acute sinusitis typically include facial pain and pressure, nasal drainage, postnasal drip, and potentially fevers. Chronic sinusitis is typically something that lasts greater than 12 weeks. This one's usually caused by either an infection that's persisting, but can also be caused by structural problems like nasal polyps or issues with your sinus drainage pathways. Symptoms are usually a little bit milder, but can be a little similar to your acute infection. So you still can be getting facial pain and pressure, drainage from the nose, but usually not as intense as those acute infections. The treatment plan for chronic sinusitis typically includes oral steroids, antibiotic courses, saline rinses, nasal sprays, and occasionally surgery if we need to clear out polyps or open those sinus drainage pathways a little bit more. To summarize, acute sinusitis typically lasts less than 4 weeks with those more severe symptoms. Chronic sinusitis, usually 12 weeks or greater with more mild symptoms. If you feel like you fall into one of these categories, go ahead and make an appointment with one of the ENTs here at Allergy and ENT Associates. We're happy to meet with you, discuss your issues, and come up with a personalized plan of care.